Good afternoon. My name is Joshua Nensey, and I am a student at Capella University, taking the Coordinating Patient Centered Care class, and this is my care coordination presentation. Thank you for attending my discussion today. To reiterate, my name is Joshua Nensey, and I am one of the staff care coordinators here at Guam Regional Medical City Hospital. Today's discussion will revolve around care coordination and its utilization within a healthcare setting. As a staff care coordinator here at Guam Regional Medical City, my role is to coordinate the efforts of different healthcare disciplines within our organization to ensure that every patient receives the absolute best possible treatment within our scope and to improve overall patient clinical outcomes and prognoses. This coordination ensures that in the event of a change in healthcare providers, that the patient will continue to have uninterrupted access to all of their necessary medications, potential treatments, procedures, therapies, or even access to the equipment that they need. In order to facilitate the planning and management of these healthcare services, care coordination facilities, and they will also help facilitate the sharing of decision making in the generation of new policies, finding new care practices, and applying relevant research. All of this will in turn promote patient-centered public health and primary care strategies. This is from Katsri et al. 2023. This lecture today that I will be having with you all seeks to explore the importance of care coordination within nursing clinical practice, its significant influence on overall patient outcomes and prognoses, and how we can effectively collaborate with both patients and the patient's family in the planning of patient treatment. We will also emphasize the importance of nurses in the maintaining of treatment consistency, how change management can affect the standard of patient care, and also what can be expected from different healthcare policy efforts. Regarding effective strategies for patient collaboration, we feel that achieving targeted treatment outcomes through successful collaboration with patients and their families really strongly depend on a combination of cultural sensitivity, educational initiatives, and tailor-made communication that works with the patient specifically. Drug-specific educational interventions are one of the biggest and most effective tactics. In these interventions, patients are given detailed information about their medications, including how to take them, possible adverse side effects, and the significance of maintaining their medication regimen. It has been demonstrated that using this strategy can greatly enhance patient outcomes and overall drug adherence to their medication regimen prescribed by their physician. This is coming from Brantley et al. 2021. Participating in the decision-making process with both patients and their families can promote autonomy and is crucial to the patient's care. When communicating any medical information to the patient or their families, including but not limited to their diagnosis, the different medications that were administered, and preventative actions, healthcare providers should do so in a very plain, straightforward, easy to understand terminology. Considering the cultural diversity of patients and their families, while also acknowledging, can also be useful strategy. This entails being aware of the cultural customs, values, and belief systems that could influence a patient's choice of medical care. This can include such examples as knowing that your patient is Jehovah's Witness and therefore it is against their faith to accept any kind of blood transfusion, or a Muslim patient that insists on fasting during the holy month of Ramadan, whether it's getting their meals from sunrise to sunset, which can also apply to tube feeding as well. Just to name a few examples of things to work around and address in a clinical setting. Healthcare professionals must be aware of these cultural differences and more, and modify their educational strategies accordingly. The health literacy and decision making of certain patients may be influenced by their cultural practices and beliefs. Studies have shown that patients who have lower levels of societal assimilation may struggle with following their prescribed drug regimen due to their adherence to traditional health beliefs and difficulties in effectively communicating with their physician due to language limitations. This is coming from Shaheen et al. 2019. When a patient's family is actively involved in their care, they can be viewed as essential members of the medical team in this regard. We feel as if their viewpoints, worries, and contributions can be really helpful in obtaining favorable health results. It is crucial to follow up with patients and their families on a regular basis to assess development, respond to worries, and offer our continuing support as healthcare providers and clinical support staff. Regarding change management and patient satisfaction, we feel that effective change management is crucial for successfully introducing and implementing improvements that enhance patients' overall clinical outcomes and general satisfaction. Efficient change management can play a key role in shaping the patient experience to provide an environment of outstanding patient-focused care. Efficient communication among staff regarding change initiatives, along with comprehensive staff training and active engagement, can foster a clinical environment with the highest standards of care. This is coming from Harrison et al. 2021. In addition, the incorporation of innovative technologies and streamlined workflows can promote better efficiency and accessibility for the organization, further supporting a patient-focused approach. In addition, implementing patient participation initiatives that prioritize patient feedback and involvement in decision making can both empower patients and reinforce a patient-focused care model within our organization here at Guam Regional Medical City. This ideology can be exemplified in Lewin's theory of plan change within its 3 phases of unfreezing, change, and refreezing. To summarize, the first step of unfreezing involves acknowledging the necessity for improvement and facilitating the development of strategies that can address the previous methods or patterns that did not work within the organization. The strategy is guided by the identification of early adopters and points of resistance, which can assist in the progression of change. During this phase, new initiatives are implemented to determine the course of a change. The second stage of Lewin's theory is the actual implementation of change brought about by supporting the altered behavior and monitoring its progress. Refreezing, the last phase of Lewin's theory, is intended to maintain the process of change and be ready to make further modifications as implicated, and to address anything in steps 1 or 2 that do not meet the overall goal of the initiative, and essentially rinse and repeat. This is coming from McGrath et al. 2020. In regards to care coordination and ethical decision making, we feel here at Guam Regional Medical City that in order to make the ethical judgments in collaborative treatment, it is necessary for healthcare professionals to work in tandem, actively involve patients in their decision making for their health, and to show a commitment to respecting a patient's cultural origins, their belief systems, and their own cultural and personal preferences. The justification for coordinated care plans grounded on ethical decision making does align with values that advocate for better patient outcomes, greater autonomy, equal access to treatment, and the overall prevention of harm. These principles guide decision making towards ethical and patient-focused care. These ethical principles are called autonomy, non-malfeasance, justice, and beneficence, and in the past, they have been applied to address ethical dilemmas within a clinical environment. To summarize, autonomy encompasses the recognition and concern for a patient's ethical beliefs, together with their right to make well-informed choices about their own healthcare treatment. Non-malfeasance is the ethical ideal of abstaining from inflicting harm to the patient. This can be achieved by implementing well-coordinated care plans that reduce the risk of negative outcomes and unnecessary treatments through good teamwork and communication. Justice refers to the equitable and unbiased treatment of patients by ensuring equal opportunities for accessing healthcare services. Beneficence, lastly, refers to actions that can enhance clinical health and the overall welfare of the patient. This may be accomplished through a well-coordinated care plan aimed at improving patient outcomes and fostering enhanced communication and collaboration amongst healthcare providers. This is from the American Nurses Association 2024. In regards to policy provision and the patient experience, we here at Guam Regional Medical City believe that provisions in healthcare policy can play a significant role on the overall patient experience and overall healthcare outcomes. Measures intended to widen healthcare accessibility and provide more equal access to unbiased healthcare can improve patient experience by making it more user-friendly, accessible, and impartial. Furthermore, policies that prioritize cost reduction or quality enhancement might also influence patient outcomes positively by guaranteeing the effective allocation of resources and increase accessibility to high-quality healthcare. This is coming from Levine et al. 2022. Studies suggest that policy interventions, including as the enlargement of Medicaid and the adoption of value-based payment models, have a positive impact on healthcare, accessibility, use, and expenditures. As a result, this leads to improved clinical outcomes and reported overall improved experiences for patients. Efforts focused on advancing health equity and improving care quality contribute to the reduction of disparities in medical care and the enhancement of overall health quality. Healthcare policy provisions have a vital role in shaping the delivery of care, the consequent health outcomes, and the experience of the patient overall. This underscores the necessity of formulating policy decisions grounded in significant information to get optimal healthcare results. This is also Levine et al. 2022. For an example, HIPAA, short for the Health Insurance Portability and Accountability Act, which we are all familiar with, is a healthcare legislation that has had a great impact on the treatment of patients. The implementation of HIPAA was intended to protect patients and their confidential health information. The patients experience more comfort in getting medical care when their health data is safeguarded, as they have confidence in the security of their information. Just to list as an example. In regards to the nurse's role in coordinating care, here at Guam Regional Medical City, we feel that nurses play a vital role in providing comprehensive, ongoing, ethical, collaborative, and overall patient-centered care. They effectively collaborate with a diverse range of individuals, including multidisciplinary team members, patients' families, local resources, management, and with the overall goal of prioritizing patient safety and delivering high-quality care. And we need to ensure positive care experiences. Patients have the opportunity to interact with nurses throughout their hospital stay and for any other healthcare needs they may have. The nurse plays a crucial role in identifying patient needs, effectively conveying patient preferences, and work collaboratively to develop comprehensive patient care plans. In conclusion, overall, the discussion on care coordination and nursing practice mirrors the fundamental principles of our profession and the ethical obligation that drives patient-centered care. By engaging in efficient teamwork, effectively managing change, upholding ethical standards, taking into account regulatory requirements, and recognizing the vital contribution of nurses, we can greatly enhance the quality of patient treatment and patient happiness. As we work toward better care coordination, let us maintain our dedication to enhancing the smooth workflow of treatment, enhancing patient satisfaction, and ultimately enhancing overall health outcomes for our patients. Thank you for your time. My name is Joshua Nensey, and I thank you for attending our presentation today.